The Coronavirus Disease Reporting and Data System, CORADS. CORADS is used to assess suspicion for pulmonary involvement at CT. Dutch Radiological Society, NVVR, developed CORADS based on other efforts for standardization, such as lung RADS or BI-RADS. CORADS assesses the suspicion for pulmonary involvement of COVID-19 on a scale from 1, very low, to 5, very high. Two additional categories respectively encoded technically insufficient examination, CORADS 0, and RT-PCR proven SARS-CoV-2 infection at the time of examination, CORADS 6. Chinese novel coronavirus pneumonia diagnosis and treatment plan incorporates CT imaging into the criteria that clinically define COVID-19. CORADS categories. CORADS 0. CORADS 0 is chosen if none of the 5 categories can be assigned because of scans that are incomplete or of insufficient quality, for example because of severe artifacts due to coughing or breathing. CORADS 1. CORADS 1 implies a very low level of suspicion for pulmonary involvement by COVID-19 based on either a normal CT or CT findings of unequivocal non-infectious etiology. CORADS 2. CORADS 2 implies a low level of suspicion for pulmonary involvement by COVID-19 based on CT findings in the lungs that are typical of infectious etiology that are considered not compatible with COVID-19. Examples are bronchitis, infectious bronchiolitis, bronchopneumonia, lobar pneumonia, and pulmonary abscess. CORADS 3. CORADS 3 implies equivocal findings for pulmonary involvement of COVID-19 based on CT features that can also be found in other viral pneumonias or non-infectious etiologies. CORADS 4 implies a high level of suspicion for pulmonary involvement by COVID-19 based on CT findings that are typical for COVID-19 but showing some overlap with other viral pneumonias. CORADS 5 implies a very high level of suspicion for pulmonary involvement by COVID-19 based on typical CT findings. CORADS 6, similar to BI-RADS 6, was introduced to indicate proven COVID-19 as signified by a positive RT-PCR test for virus-specific nucleic acid. It must be interpreted together with the duration and type of symptoms, as well as clinical and laboratory findings. Helps in clinical diagnosis of COVID-19 with or without lung involvement before reverse transcriptase polymerase chain reaction tests RT-PCR are available.